Hi, welcome to the podcast 101 Thoughts. I'm your host today, Ananya Menon, here to talk about the American healthcare system with our guest, Jeremy Khan. Thank you for joining me today, Jeremy.
Thank you for having me.
So, what do you think is the biggest issue in healthcare today?
Well, in my opinion, I think the problem with healthcare today is lower and middle class people just don't have the ability to find care that's affordable and available to them at all times.
That's pretty true, honestly. So, do you think that Medicare and Medicaid do enough to support the communities that need them?
Well, Medicare is very helpful to everyone who uses it. It's almost impossible to find a clinic that will not accept Medicare as a form of insurance, but Medicaid, on the other hand, needs a lot more funding. Medicaid and its local equivalents don't get any funding, which keeps it out of a lot of smaller clinics. They just won't accept it as a form of insurance. Medicaid users are forced to go from clinic to clinic trying to find one that will accept them or go directly to the ER, which is notorious for higher prices.
Right. So, do you think that how do you think that policymakers could help these patients?
Well, to start, I think they should lobby for higher funding, and for federal healthcare, that would be the best way to help them.
Yeah, for sure. And how do you feel about open insurance plans such as PPOs?
Well, they're better for most patients because their insurance companies are certain to be accepted at any clinic. This advantage, however, comes with higher prices. For most people, these plans are provided through their employers, so it doesn't make too much of a difference. But they have to have an employer willing to spring for PPO versus an HMO.
Right. And what exactly are HMOs?
Well, HMOs, that stands for Health Management Organization, are insurance plans that restrict the patient to going to certain locations that they have pre-approved. So you have to select a specific primary care physician and you have access to many specialists, but you need a written referral from your physician and have it approved by insurance in order for your insurance provider to cover anything from a visit to a specialist.
I see. And so you were talking about medical referrals. So what is your opinion on those?
Well, it's a guaranteed way for patients to get their health services covered by their insurance. Most Americans use HMOs, so they need these referrals to get their health checked out. It's tedious to go through your primary care provider, ask them for a referral, and wait for your insurance company's approval, though. And that's what most people hate about HMOs. You have to wait for your insurance company, which is supposed to be on your side. And to respond back and give you permission just to better your own health.
Yeah, I think that's pretty weird, honestly. Do you think that requiring medical referrals is ethical because people need to go to the general doctor and the specialist instead of just directly going to the specialist?
Well, you see, most people who don't need referrals will go to both doctors either way because they want to ensure that they're finding a specialist for the exact issue that they need. Most of the time, it's difficult to locate the exact issue going on with your body unless you're a doctor yourself or have some kind of medical training. But if the average person went directly to a specialized care facility, they may end up incorrectly assessing the problem and then have to go to two specialists, which could end up making their bill even worse. If we pretend that everyone could assess their issues perfectly, then of course it seems like it has to go to the general practitioner and a specialist. But it also seems like a really small price to pay for the HMO plan, which costs less than open plans. That being said, it is ethical because it is a part of what you sign up for when you sign up for any private insurance plan, but that's just my opinion.
And do you think medical referrals reduce the cost of healthcare?
Yes, they definitely do. Because if you go to a specialized health service without a referral, you are at great risk of an insurance company refusing to pay for any part of the visit. So if you have an HMO like the majority of Americans, don't try to get away with a secondary healthcare visit without getting a referral and approval.
What do you feel that every patient should know about healthcare? Because honestly, a lot of this stuff is it's really not common knowledge. And I didn't even know about a lot of this stuff until I started researching and looking into it. But I feel like this should be pretty common, pretty well known.
So just one thing that I think people should know.
Yeah, what do you think that every patient should know?
People need to be informed about what exactly the plan they choose covers, so that they don't waste their time and go to places and try to get treatments that their insurance does not cover. For instance, a lot of plans have a clause about vitamin shots. Mm-hmm. Patients will sometimes walk into a clinic and get the vitamin injection, and a week later get a bill from their insurance for a shot that they thought would cover it, but it just didn't.
And do you think insurance companies inform their patients enough about their coverage?
Legally, yes, they do, because the patient signs a contract from them and has access to exactly what their plan covers. But it's not that simple because they're filled with legal jargon and people get way confused to try to comprehend that thing. You shouldn't need an advanced law degree to figure out what your healthcare covers.
Absolutely. And so like say they just wanted to call their insurance, do you think that the process of contacting the insurance company is accessible enough?
Well, that varies from company to company, because some companies do really well with their customer service sectors, and they'll go step by step and help out the patient if they really want to know, and they'll do it in a timely manner. But most insurance companies skimp out on their customer service sector, and so patients are stuck on hold with their insurance provider for hours trying to get a simple yes or no answer about just the tiniest detail. They just want their treatment covered, and they just won't get the treatment, the necessary customer service they deserve.
Right. And so switching gears like just a bit, could you explain what it means to gatekeep medical care?
Well, I guess that's a pretty evil term. Well, essentially, it is accurate. Basically, it's how we choose to ration medical services. So, like, when you go to a doctor and they prescribe you medication, there's a limit of how much medication you can have at any given time, and you'll have a certain amount of refills. It's a way to make sure that we don't overuse our resources, and that's why we do it. But we have referrals in the first place because we don't want people swarming a podiatrist's office for a sprained ankle when you can get a pain reliever from just a general practitioner.
That actually makes a lot of sense. Okay, Jeremy, thank you so much for your time today. I think we learned a lot about the American healthcare system. Any parting words?
Nah, just make sure you know what you're getting into anytime you sign something. That's all I can say. That's the best advice any medical practitioner can probably give right now.
That is fair. Thank you so much. In the next section of today's podcast, you'll hear an interview with an average citizen, Parvati Jiska. She'll be interviewed on her opinion on the American healthcare system. How much do you know about insurance referrals? Nothing?
Nope, that's fine.
So basically an insurance referral is something that your insurance company requires that you get from your doctor, from your primary physician, and your insurance company has to approve it. And then this allows you to see other doctors like within that insurance company's network. So you have a select few doctors that you can see for special treatments. This includes anything like ER visits are included in this, gastroenterology, dietitians, other more specialized things other than general illnesses. So how do you think do you think it is ethical that some insurance companies can require referrals from doctors? Because studies have shown that this can increase prices for patients sometimes because they have to go to two doctors. They have to go to their general doctor to get the referral, and they still have to pay for their visit. And then they have to pay for another visit from the specialist.
So, is the referral like for people that can't like afford insurance, or is it like
it's through their insurance? So they already have it, and so they need the referral because otherwise their insurance company is not going to cover the specialized visit at all. At least with the referral, there is partial coverage, depending on the plan.
okay? So,
do you think it's ethical that some insurance companies can require it, even if it means that the patient has to go to two different doctors?
I mean, I don't know too much about like the referral thing, but I don't think so. It just doesn't seem ethical. Yeah, sure. I mean, no. I mean, like, I actually have to like understand like the whole concept behind it to like actually decide like whether it makes sense or not.
Okay. Do you feel that Medicare and Medicaid do enough to support the communities that need them? Medicaid is
the governmental.
Yes, the government for the impoverished, and Medicare is for the elderly.
I guess they're like probably not, because like just considering how many people like in the impoverished community like have to admit themselves to the ER when they're in a state of emergency just shows that they're not getting like the correct ways to access those resources. where it should be like the duty of Medicare and Medicaid to like spread and like help them access those. So I feel like even though it is being like even though a lot of people are having access to them, it's really hard for like other communities to get those kind of resources that other people are having access to. So I feel like not as like the Medicare and Medicaid programs are just like not as
strong as they could be. Yeah. Do you think that healthcare spending could help this, or do you think that it needs to be more vocalized? Because you are an average citizen of America. Like, you clearly haven't like known much about the insurance industry. So why do you think that this is such a big issue and yet not the average person just doesn't know about it? So do you think that the government needs to be more vocal about what they're doing, like with healthcare?
Yeah, for sure. I mean, like, if the government is more vocal about it, then people will have more access to those resources. They'll have an idea that these kind of things do exist and these kind of resources are available like within their reach. Because based off of what we're seeing right now, a lot of people don't know what kind of resources they have at hand because the government just is not like conveying those kind of resources to those people. So yeah, it's definitely important that the government is more vocal about these kind of things.
Is there anything that you think your health insurance provider should tell you, or wish that they had told you sooner?
Yeah, for sure. Just a couple of weeks ago, I got my blood tests, and last week we actually got a bill that we weren't expecting. And our healthcare insurance provider or our doctor didn't tell us that that specific blood test was going to be an out-of-pocket charge, just because I got that blood test when I was sick. Usually when people get blood tests, the insurance covers it completely for them because they get the blood test during a wellness visit. But because I got it during a sick visit, and I got it because of my sick visit, there was an out-of-pocket charge that our insurance company just didn't tell us about. So I've seen this happening to a lot of people where they're getting bills and they're required to pay money that they just did not know about.
They didn't know that they signed up for this.
Exactly. And it's definitely important. Like, sure, insurance companies, they have like their own policies and things like that, but it should be something that is conveyed like directly. And
you would say more than just the contract signing itself.
Of course, yeah. Like, definitely, like, when the contract is being signed, the specific things that the insurance covers and doesn't cover should be conveyed verbally or something like that. So the customer has an idea of what they'll have to cover and what they won't.
Mm-hmm. Have you heard of copays?
Yeah.
That's like the per visit charge.
Right.
Just out of pocket. That one is the one that most people are familiar with. It's like the only thing that you know is out of pocket during your visit. And then all these other charges, they send you a bill and they're like, oh, deal with it. Exactly.
Not good. Not good.
It's not.
And like, it's not really fair for many people because they can't afford those kind of things. Some people are just lucky and they're able to afford it, but other people who sign up for the insurance company thinking that a part of their medical bills will be covered are just thrown in the face with these kind of things, and they just don't know how to deal with it. Mm-hmm. It's an issue that's going around.
I'd like to switch gears for a minute. Have you heard of anything called a diagnostic related group?
Do you have an example?
It's not really like it's a cost saving measure, but for the doctors. Okay. So this is something that doctors can use to diagnose people easily, so that they can write it in in the patient's files. Mm-hmm. And so, in using this, suppose that the doctor tells the patient to be admitted in the hospital. And if he or she says that the patient needs to be at the hospital for X amount of days, certain DRGs can say that if the patient goes above, then the doctor gains a profit. And
Patient goes above what?
Above the X number of days admitted in the hospital. And if the patient goes below, then the doctor has to bear the loss.
Okay.
So now this is an economic factor that a lot of people are very wary of. And how do you think that economics should really play a factor in general practitioners and like what they prescribe? Because do you think that this is an incentive for doctors to admit people for lower days so that they don't have to bear a loss?
So you mean doctors having to... Oh, I see. So basically the doctor says that the patient has to go to the ER for X number of days, and if they go for above, then the doctor makes a gain.
A profit, yes.
Yeah, but if they go for lower, then the doctor makes a loss. So you're saying what is the
it's really more of an ethical question.
Right.
It's is it really okay for economics to be playing such a big role in the safety of patients' lives?
Definitely. I feel like it's really important that patients get the care they need in the specific number of days that works out for them. Because if economics starts playing into a role, if economics starts playing a role into these kind of things, then patients will probably stay in the hospital for lower days than what they actually need to, and they won't get access to the care they need. Exactly. So it's really important that economics, sure, they have some kind of role into the whole hospital workforce kind of thing, but it should definitely not be a deciding factor as to how many days a patient should stay in the hospital or not. So,
right.
Yep.
Yeah. Now that we've talked a lot about the ethics behind doctors' prescriptions, are there any stories about health insurance that you would like to share?
Sure. So my brother is working in a company. Their insurance policies, or their health insurance partnership is he's told me that for his dental visits he's only had to pay a copay of $10 or $15 and a $100 deductible. And,
wow.
Yeah. While I've
God.
known of other people who have to pay $150, $200 copay and their deductible is $6,000. And I feel
they just never hit their deductible.
Exactly.
It's a really big problem.
Exactly. So every time they go to the hospital, everything is out of pocket until it hits that deductible.
Yeah.
And for many people, they don't really go to the hospital often. So every time they have to end up going, they just end up paying everything out of pocket. And I feel definitely when there are certain kinds of jobs that are very hard to get into, they usually end up having a lot of good employee benefits, but it's not necessarily fair for people as a whole. Just looking back at what people do to get to that position, because many people who have very tough jobs end up having to pay for insurance, and they end up having to struggle, while people who work hard to get to a certain place and just don't have to pay for anything else just have it easy after a certain point. So I feel the balance should definitely be established between healthcare, how much people have to pay, looking at their social status, just looking at their other spendings and things like that. And it's just crazy how much the amount people have to pay just differ from person to person and job to job.
Basically just to survive.
Exactly.
It's just the simplest thing. You have a little cough, you go to the doctor because it's not going away, and you're suddenly faced with a $600 charge.
Yep.
Okay, well, thank you very much. I really appreciate your taking time to do this interview.
No problem.
Thank you. Have a lovely day.
You too.
Thank you for listening to the 101 Thoughts podcast.